Yes. All right.
Okay, so if I can have your attention, please. Thank you. So we're gonna get started. We apologize for the delay. We had a little challenge in setting the camera up, but we're good to go. So we have a number of people who are coming in via the WebEx. So thank you all who are in the audience that are not here. Thank you all for your time to come today. So my name is Joseph Telfair. I'm the Associate Dean for Practice and Research. This grand round is one of a series of seminars that we are conducting out of the Office of Practice and Research that allows us to showcase both the excellent and outstanding work of our faculty and our students. And we will be continuing to work on these and have these over the course of the next year and going forward. So today is our inaugural grand rounds, and we are extremely fortunate to have Dr. Jessica Schwind here today to speak about an area where she's really passionate about. And as you know, Dr. Schwind, briefly, is an epidemiologist, and she joined our department a couple of years ago. And she's done a lot of work, and she will talk about that work. So I'll let her introduce herself because of time. I was going to spend a little more in bio, but I'll let her say what she needs to say. So again, thank you all for attending, and please complete our assessment and tell us what you think, and we'll move forward because our goal is to have more of these and to make sure that we are able to provide the type of information that you need, as well as to really excellently showcase what it is we can do here in the College of Public Health. So thank you for your time, and with that, I will turn it over to Dr. Schwind.
Thank you. I'm super thankful for the opportunity to talk about something that I really do love, which is the OneHealth approach. When I was starting to come up with what I was going to talk about and figure out how I was going to frame it, I was reading a lot of papers on zoonoses and emerging infectious diseases, and there was one word that kept coming out, which is complexity. This is very much a complex problem, and so my job was made very hard to try to come up with something that I can say in an hour. And in fact, I'm going to do things a little differently, so hopefully that's okay. I am an epidemiologist, and so I usually deal with numbers quantitatively, like I do a lot of data analysis. But as I was reading, I found this paper that said some ecosystem researchers conclude that complexity, as manifest in wicked problems, are best investigated and understood using narratives, including diverse narratives. Narratives, because they are observer dependent, expose what in many epidemiological models is hidden. And there's a lot of issues that come to the surface through that. And so I thought that I would kind of expose my personal narrative and talk a little bit about OneHealth through the context of my life and what that has looked like from the very beginning on to my research. So if you could bear with me. So to start off, I want to give you a little bit history of my family. I have a long history in farming. I come from several generations before me were farmers and very much lived the agrarian lifestyle. We had a lot of really cool animals around us a lot. This is my great-grandma and my great-grandfather. And unfortunately, my great-grandfather passed away very young and left my great-grandmother with 13 kids to raise. Now, this was definitely important to farming families because you needed that type of manpower in order to get the harvest in. Now, with that, there were some really important events that happened. If you grew up on a farm, you know that sowing the seed, planting the seed is very important to farming families. This is my grandfather and some of his siblings actually planting tobacco plants from seedlings. And then, of course, if planting is very important throughout the year, then also harvesting is very important throughout the year. This is one of my great aunts in the pea patch. Unfortunately, or fortunately, as a teenager, I had to spend a lot of my summers in the pea patch. I had a lot of friends who got to go on fun things, fun adventures like to the beach or to the lake or to the pond or river. I spent it in the pea patch. But it was still very important to our family. And so another thing that was very important to our family was the human-animal bond. This is, I was told, Ada, Emma, and Nell. They were workhorses on the farm, and they were well taken care of, so well taken care of that they got a name. But obviously, throughout history, there's been technological advances, and ultimately, when the tractor came to the farm, then Ada and Emma and Nell were traded in. But still very important time in our family. Now, looking forward, I have, from that time, my great uncles and my grandfather were farmers, and that continues on today with my father and my cousin and my uncles being farmers as well. And sorry about that. And so basically, they spend their time, and that's how they get their livelihood today. So looking forward at the human-animal interactions, from a young age, I really learned the importance of the human-animal bond. The human-animal bond is a mutually beneficial and dynamic relationship between people and humans. And it's really influenced by behaviors on both sides. And those behaviors contribute to the health or well-being of both species. Now, this can include, among many other things like the mental health component, the physical health component, and it also includes all of the interactions that occur between people, animals, and the environment. So let's look a little bit at those interactions. Now, obviously, livestock is very important. If you like to eat meat, then that is definitely important to you. Also, dairy products as well. How many of you have pets here? Very good. So, pets tend to be a really interesting topic. How many of you would buy something for your pet before you'd buy something for yourself? Yeah. Everybody's like, yeah, that was me. Went to PetSmart yesterday. So pets are a great representation of the human-animal bond. Also, we have equine, both for work and leisure. And then something that's surging right now is the presence of backyard poultry, and even in urban areas. So the idea of community poultry is big. Now, there's animals in urban environments, especially when you look at live animal markets where you can actually go to the market and say, I want that animal on my dinner table tonight. And that is definitely present here in the United States and globally as well. And then also you come into contact with animals through hunting, through fishing, just being here on campus. You have squirrels that you may like to admire between classes. And then you have service and companion animals, in addition to visits to the zoo and just chance encounters with wildlife. So I may have missed a couple, but ultimately you can see that the human-animal interaction is very important. Now, what that leads us to is the idea behind OneHealth. Now, the idea behind OneHealth is very simple. It's not complicated. It's just thinking that human health is dependent on animal health and environmental health. If animals or the environment are not healthy, then neither will the humans be, okay? And it goes all different ways, okay? So you can't ensure human health unless you ensure animal health or environmental health. So it's a really simple concept, but the hard part is how do we let that concept inform our practice? Now, the history of OneHealth is kind of as long as human history goes. Obviously, human history is entwined with the domestication of animals. Hippocrates even wrote about on airs, waters, and places the idea that you need to think about the food you eat and the air that you breathe and the seasons that exist in your environment. But it was quite some time later that really veterinary art at that time transitioned into veterinary medicine, veterinary sciences, and that happened with a French surgeon in 1761. Then you have Rudolf Virchow, who coined the term zoonosis. Now, zoonosis is just a disease that you can get from an animal as a human. And understanding that transmission of diseases from animals to humans is really important, and we'll talk about that later. Then Dr. James Steele came on the scene. He started the field of veterinary public health, and then Calvin Schwabe talked about it in terms of one medicine. Now, OneHealth today encompasses literally everything. So if you're practicing public health, then you technically fall under this OneHealth umbrella. If you are a practicing veterinarian, then you fall under this OneHealth umbrella. Now, the problem is what do we do with this information, and how do we let it inform our actions? Now, a lot of different organizations have adopted the OneHealth approach. That includes the Centers for Disease Control and Prevention, as well as the World Health Organization, the FAO, the Food and Agricultural Organization, as well as the OIE, which is the International Animal Health Organization. A lot of people are signing up for this OneHealth concept, this OneHealth approach that says, you know, even though we are focusing on human health, we are going to understand that human health is actually a small part of a very complex system. So that brings us to wicked problems. Now, we just finished with Halloween, so I just thought it would be interesting to talk in terms of wicked problems. Wicked problems is actually a term used in policy or planning literature. It originated in the 70s, and what it did was it helped people, especially policymakers and planners, talk about complex problems that really don't have easy solutions, which, you know, in many cases are the specific areas of focus in public health. They arise in situations that can be defined from a variety of apparently incompatible perspectives. They're really difficult to define, and there's no immediate test to solutions. And you've got multiple actors who are playing a role, multiple causes, and the internal dynamics are really complicated. It's non-linear, meaning if you make one change here, you see that change here. It's not that easy, right? So you're probably saying, oh, okay, well, that's really what we're dealing with in global health. Many of these global health problems that we encounter are or could be described as wicked problems. In fact, there is something now called super wicked problems. And what that means is it's characterized by the fact that time is running out and that there's no real central authority who's kind of stepped up to tackle the problem. So if that doesn't describe climate change, then I don't know what does, right? So super wicked problems. Now, I want to take a second and I want you to take that OneHealth lens that I just provided you and go down this list and think about the OneHealth applications for each of these problems. Now, some of them are going to be super clear, right? Like, oh, I can see where an animal fits in here. I can see where the environment fits in here. I can see humans. Some of them may not be so easy, but the whole purpose of this talk is I want to encourage you to look at these problems through the OneHealth lens so that when you go and practice, you're not only thinking about human health, but you're also including animal health and environmental health in that endeavor. And I would venture to say that a lot of us probably became public health professionals because we saw what a medical doctor did and they were like, oh, they're treating that one individual person. No, I'm good. I'll treat the whole community instead, right? And so why treat the whole community when you can treat globally, you know, planetary health, looking at the animals, the humans, and the environment. Now, that is why we have a need for OneHealth and really the systems thinking approach. You're not going to solve a problem by simply looking at the individual components, okay? As an epidemiologist, I'm here to say we're not going to solve any problems by just simply looking at a relationship between X and Y, especially in the vacuum of research. To understand the system, you really need to understand how those components interact with one another because frankly, it's not just about people anymore, it's about planetary health. And because of interconnectedness, a positive impact on one health sector may actually have a ripple effect on all the other health sectors, but only if those linkages are understood. And that's really why a transdisciplinary approach is needed. Take, for example, let's say you have a mosquito problem, okay? You're not going to drain the swamp and then cover everybody in DEET, okay? It may like be a temporary fix to your mosquito problem, but ultimately it impacts the environment and the animals in that ecosystem. So that type of systems thinking is needed. So when I say transdisciplinary approach, what does transdisciplinary really mean? What's the difference? Well, first let's talk about disciplinary. I don't know if you've ever had anybody tell you to just stay in your lane. And I don't mean driving, but I mean in terms of research. I personally have had people say, Jessica, just stick with what you know about. And it's not really a good feeling, right? Especially when, say, a journal editor is working for a journal that says, hey, multidisciplinary, interdisciplinary research is where it's at. But disciplinary just simply means stay in your own lane. Multidisciplinary means that basically everybody kind of stays in their own lane, and then at the end they come together and put their products together and say, here you go. So for example, I really love online learning. If I'm designing an online course, I may work on all the content, but ultimately I take it to an instructional designer. They, make it look really good, and then I take it to IT in order to get it on the internet. Everybody's kind of doing the job that they were hired for, but together they make a course, right? So that's multidisciplinary. Interdisciplinary, you will actually hear OneHealth talked a lot in these terms, because interdisciplinary takes it a step further and it analyzes, synthesizes, and harmonizes links between disciplines in order to have a coordinated response. So what an interdisciplinary meeting may look like is we all come to the table over in the College of Public Health. We have an environmental health professional, we have an epidemiologist, and we have a statistician. We come to the table and we work on our components together as one. But I want to take it a step further today, and I want to say that OneHealth truly is a transdisciplinary approach. And what that means is it integrates the natural, social, and health sciences into context of humanities. It transcends their traditional boundaries, and what it does is it operates in the field and it works with communities in order to understand those complex linkages that we maybe would not see readily in a classroom. So transdisciplinary thinking is really a context-driven, problem-focused approach. And what that means is we identify a problem, which is very hard, especially in the case of wicked problems, and we come together and we focus on that problem, bringing together our unique backgrounds. And that involves collaboration between the academic sectors and the non-academic sectors, which I feel is frequently not done. And then results in knowledge production and encourages public involvement. And that adds another layer to this already complex system, because we are usually learning things in silos. And so here's some silos. For example, at a medical school, if you're a future physician and obviously your focus is on human health, you're not going to spend any time usually on animal health or environmental health. You're simply focusing on human systems. In veterinary medicine, now they've been a lot better in terms of incorporating the OneHealth approach, but you're still going to focus on animal health. And then environmental health, even better, they do understand the complex web of ecosystem health. But then even bringing all of that information to the general public is difficult. And that communication is really needed. So in order to illustrate kind of these points, very much imperfectly though, I'm going to talk about some of my research. And I do research in Nepal. And I've been researching in Nepal now for about going on 5-6 years now. And I love Nepal. Nepal's great. So I'm going to talk a little bit about this country. So first, Nepal is a landlocked country between India and China. It has an estimated 29 million people, and it's considered one of the least developed countries by the United Nations. You can see where it falls on the Human Development Index. And agriculture really is the mainstay in Nepal, and but unfortunately it doesn't make a lot of its gross domestic product. A lot of the industries associated with Nepal really focus on exporting those agricultural products, just not very well. There are some natural hazards. Nepal has a wet season and a dry season, so during the wet season or monsoon season, that brings to light a lot of severe thunderstorms, flooding, landslides, and then during the dry season, drought and famine. Some of the environmental issues that are plaguing Nepal right now is deforestation, degradation, erosion, contaminated water, solid waste in the water systems, and vehicular emissions. In the northern part of Nepal, you have not so famous mountain range called the Himalayas. You got Mount Everest right there. In the center part of Nepal, and that's really where the built-up areas are, including Kathmandu. You can see a picture here. And then in the southern part of Nepal, you have really a hot spot of biodiversity, including like jungles and stuff. So it's a very diverse country, even though it's pretty small. Now, looking at the population graph, you can see that life expectancy falls off drastically in Nepal. I believe the average life expectancy is around 71 years of age, and obviously males are a little bit lower than females. And the GDP per capita is around $2,700 a year. Now, another thing that you should know about Nepal is they have about a net migration of negative 2.5 people for every 1,000. So you have a lot of people leaving Nepal, in particular young men who are going to the Middle East in order to find jobs. Because they're just not there in the country. And so that has a huge impact on the social structure there. Now, I went to Nepal in order to study emerging infectious diseases. First as a graduate student at UC Davis, who is known for their OneHealth research. And you may say, well, what does emerging infectious diseases really have to do with OneHealth? Well, a study was done. It's a study that I talk about because it pretty much serves as the foundation of all of my research, which is in 2008, Jones et al. Basically said, I'm going to look at all of the different emerging infectious diseases that have come on the scene lately, and I'm going to see, okay, well, what do they have in common? And so with her team, she classified all of the different diseases, and she found out that about 2/3 of all emerging infectious diseases come from zoonotic sources. Not only that, about 75% of those come from wildlife sources. So when we're talking about diseases that are newly emerging, we're talking about diseases from animals, zoonoses. And this is really important. So you can see the red here. That's what we call hotspots. Now, hotspots was a term used in conservation that has now, I guess, been taken in terms of emerging infectious diseases. And what it means is it's the areas where humans and animals interact, and it is at that point of interaction that's really intense and prolific that diseases, zoonoses, may be able to emerge. Okay, so when you think of some recent examples, SARS is a big one. Ebola is a big one. All of those have animal health and environmental health components. And so I've always been interested in disease surveillance as an epidemiologist. And when you look at the traditional surveillance information cycle, here in Georgia, this is kind of what it looks like, right? You've got your clinician who sees a disease in the clinic or in the hospital, and they have to report it if it's mandatory to a health district, a local health district. This is the South Central Health District of Georgia. And then they report it to the Department of Public Health at the state level, and then they may report it to the CDC, and the CDC has certain reporting guidelines to the World Health Organization, though those guidelines are not the same at each step. Now, the idea is that you have this individual reporting at each step, ultimately in order to give feedback down the loop, okay? Ideally, that's the way that it works, but in countries such as Nepal, where you do not have the best infrastructures to support surveillance systems like this, and even when you do have surveillance systems like this, they don't really operate as planned. That's when we start to look at non-traditional forms of surveillance. You can get an idea of diseases that are in the population by looking not necessarily at clinicians' records, but looking at other things. So, for example, how many of you, when you get sick, you go to Dr. Google? like I'm coughing, joints achy, low grade fever, I'm gonna die. Okay, so ultimately there were people who Googled, those symptoms, and then they analyzed that information and they saw, oh wow, in certain flu seasons, we can actually see a flu epidemic underway about 12 days earlier than the CDC. Okay, so that's a non-traditional form of surveillance. Now, I want to give a shout out to Dr. Fong, who does research with social media in this field as well. You can also look at things like restaurant reservations. So, for example, if I'm wanting to look at, how is the flu impacting Atlanta, Georgia, then how many of you have heard of OpenTable.com? Yeah, so some people go online and like reserve a table. They can actually see, oh wow, there are more tables open for reservation than what would normally be expected, something's happening in the population. So using those kind of non-traditional forms of surveillance is super helpful for somebody who maybe doesn't have access to the healthcare data, or maybe that data is not even there. So one area of focus for me has always been newspapers. I am a news junkie. I love reading the news. I'm addicted to it. And I said, well, why not just do it for research? So looking at the role of news media in health communication, I think we can all agree that the media is really critical for the movement of information, especially when trying to convey risk information. The media, however, tends to be highly selective when reporting risk. For example, when one of the Ebola epidemics was happening in West Africa, that made for a really good news story, but ultimately our risk was very low. But the things that maybe we're high risk for, like cardiovascular disease, is not going to really make it to the front page of the news, right? So source selection, tight deadlines, selective coverage, and lack of expertise on the topics really start to complicate things when you are looking at how the media may convey this information to the public. And so if we're talking about wicked problems, then understanding communication flow is going to be really important, especially in the news media. Now, I don't want you to think that this is only in the case of like looking at a country like Nepal. This is a screenshot of the Toronto Star, which is a very famous Canadian newspaper that a couple of years ago actually posted on their front page a poorly written article on the HPV vaccine. Eventually, that article was taken down, and when there was a huge uproar, but basically they were trying to say that a couple of girls' side effects were based on this vaccine. And so what that teaches you is that basically truth in journalism doesn't necessarily mean truth in science. Now, that is not like a scathing report on journalism, but when you think about the purpose of journalism, and in many journalists' eyes, they say, you know what, we want to be fair, we want to report on both sides, we want to be balanced, and we want to kind of give both views, and then let the audience decide. In science, we don't really do that. We investigate and then we report. So it's just a way that our systems work a little bit different. Now in Nepal, the media environment was undergoing a really interesting change. There was a transition to democracy in 1990 when the monarchy was starting to go out. And then a communication policy was adopted in 92. So we've really seen this media environment grow over the years. And so what I did is I looked at Health Map, which is a news aggregator online that says, okay, here are all the different news stories that are coming, in my case, out of Nepal. And I looked at that and I scanned it for OneHealth related information. Now, Health Map is really cool. I would definitely bookmark that site if I were you, because you can see what's happening in your local area in the news when it comes to health related events. But like I said, I only focused in Nepal, and I looked at the event reports, the report topic, and I wanted to see how well did they report things like human health issues, animal health issues, and environmental health issues. Now you can probably see from this grayed out area that news aggregator did not pick up any environmental health related articles, which was really sad because, like I said, in Nepal, there's such a huge biodiverse population there when it comes to looking at plants and animals and just ecosystems as a whole. There was one health article, but the majority, as you can see, really focused on human health, which I don't think would really be a surprise to us. The one health article had to deal with pesticide use and how it impacted honeybees in the fall. Then a lot of the news reports came out of the central area, which is where Kathmandu, the capital, is at, and also the eastern area, which is the second highest populated part of the country. Now, in order to do this, the transdisciplinary approach that I took was really trying to get journalists on board. So a second study that I did was to really look at the journalist perspective. What type of things are they seeing in the field? What type of issues are they encountering? And what is it that they would like to know more about in terms of OneHealth? We found that health journalists in Nepal was not really a thing. They were just journalists. And they happened to report on health issues. Few journalists reported receiving specialized training in any particular health sector, and they acknowledged a real lack of understanding of that interconnectedness. OneHealth, in this context, provides a conceptual framework in order to make these articles even better. So not just focusing on the quantity of articles that are talking about OneHealth, but really talking about the quality. So for example, if they're reporting on something like Japanese equine encephalitis, then they're going to talk not just about the vectors, but also the natural hosts like pigs and stuff. So that was really important. The second thing that I did in Nepal, so in between the first earthquake and the second earthquake, I decided to fly to Nepal. We had an outbreak investigation course training scheduled, and once the first earthquake happened, I was like, okay, well, yeah, y'all probably don't want to do outbreak investigation right now, and they're like, no, we need it right now. So that's really learning from the community. And so flew out there, and in the middle of that outbreak investigation course, the second earthquake happened, 7.3 aftershock, and ultimately it was very devastating to an already devastated community. Through that, I really started to understand the relationship between health and natural disasters. And I noticed that while my entire career was focused on infectious diseases, that there was really huge gaps in the OneHealth literature that looked at mental health. And so I teamed up with a group out of Kathmandu, Center for Molecular Dynamics Nepal, as well as a group out of Maine Medical Research Institute, and we looked at mental health in some of the hardest hit villages. And you know, mental health in a country with a lack of primary care infrastructure is kind of stigmatized and set off to the side. And so there was a very little knowledge about the mental health outcomes before the earthquake, so we didn't even know what we were dealing with, and then certainly post the earthquakes. So we worked in the Fulpinganda village in the JPHCOPH district. It was a very isolated community, but it was completely devastated. 100% of homes in this community were destroyed during the first and second earthquakes. It was very hard to get to, but it was a very vibrant population. They experienced 10 deaths in the course of this earthquake, and this is just we had to have a special car in order to drive it up the mountain, and so that we didn't roll off. And then through the transdisciplinary process that we adopted, working with the village, working with mental health professionals, I as the epidemiologist, and developing culturally competent materials, what we were able to do is to start to assess the mental health of that population approximately 1 year after the earthquake. Now you can see here, this is pretty much what was left of the village. You can see where land was cleared out and makeshift houses were built, and that's pretty much what the village looks like. Now, we found that about 33% of the residents screened positive for depression and for severe PTSD, 9% for severe PTSD, but about 46% of the population displayed moderate to high resilience. And if I had to describe the Nepali population in one word, which is not doing it justice, it would be resilient. It's really, really amazing. We also wanted to look at what specific earthquake exposures were associated with certain mental health outcomes. And so we kind of categorized it through a standardized tool, and we looked at things like damage to home and goods, resource loss, exposure to the grotesque. And what we found was some really interesting findings, like resource loss was associated with depressive symptoms, but then resilience was associated with less damage to home and goods, but more exposure to the grotesque. So that was really interesting. In the children, we saw that there was about 3% who displayed symptomatology of depression, and about close to 5% with PTSD, which is kind of reverse of what you would have expected. The number of earthquake exposures had strong positive correlation with PTSD and symptomatology. One of the hardest things that I had to do during this time was actually leave the village. This village is an amazing village, and they were starting to build poultry houses in order to address some of their livelihood sustainability issues. One thing as an epidemiologist that I was not able to actually see on a quantitative survey that was developed was the impact that livestock had in this case. Because I used validated screening instruments in order to look at these mental health outcomes, there was not areas for livestock loss. And during that time there, I was able to see, Jessica, like, you know about OneHealth. Like, you already knew about OneHealth going into that study. How is it that you were not prepared for this? And so I'm super thankful that hopefully me and Holly, graduate student who's working with me, we're going back in the spring in order to try to quantify that bond between the livestock in this village and the humans, because ultimately they really recognize that, okay, we had 10 deaths, we have to, continue, we have to go on. That's the resilience part. But what am I going to do, because now my livestock's dead? Livestock has to deal with their food security, and livestock also has to deal with their livelihood, how they earn money. So that's something that we're wanting to dive a little bit deeper in. And you can even see that the livestock in some cases got better accommodations than they did during the disaster response. Now, I don't want you to think that you need to fly all the way to Nepal to see these wicked problems, okay? There's actually a lot that's right around here. So I want to introduce you to that community that I talked about at the very beginning of this talk. This is Wheeler County, Georgia. It's about an hour and a half away from here. It is the community of my family members, but it's also the community that I live in now. Now, when looking at the numbers, we have about a population of less than 8,000. About 25% of the houses have broadband internet access. 10% of the population has a bachelor's degree. 33% of the population lives in poverty, and $28,000 represents the median household income. And unemployment is about 6 times the national average. And unfortunately, with the latest data out of the American Community Survey, it seems like Wheeler County is now classified as the poorest county in Georgia. And you know that we have 159 counties in Georgia. So just to introduce the county, I have this video.
Less than 8,000 people live here. Towns around here are known for logging, and it is home to the Wheeler Correctional Facility, which is Georgia's largest prison.
The only thing I can say as far as employment is Ben, the president.
GM Joyner has seen it all. He's been mayor of Glenwood since the early 1980s.
They don't pay a great salary, but there's so many of them. See, these prisons got almost 3,000 inmates. It's the largest prison in the state.
The prison has welcomed help to the economy, but 2014 was a rough year. That's when the Lower Oconee Hospital in Glenwood closed for good, and 120 jobs went with it. Not just jobs, but with doctors, nurses, emergency care, when every second counts.
It now takes an ambulance more than half an hour to get from this portion of Wheeler County all the way down to the next closest hospital.
Whenever we take somebody far out of the county, if it's a 20-minute ride to that hospital, it takes us 20 to 25 minutes to get back into our 911 zone.
20 miles doesn't sound far, unless your life depends on it. J.P. Perry is a paramedic working in Wheeler County, where they have a total of 2 ambulances.
We have 5 minutes from the time that somebody goes into cardiac arrest to the time that brain cells actually start dying.
That means if you make a 911 call, it may take 45 minutes for an ambulance to get there. There are challenges, but people in Wheeler County have something money can't buy.
These rural areas, and Glenwood is not unique, it's a wonderful place to live. But you're gonna have to accept the fact that you're not gonna have quite as much services. It's a trade-off.
Income has improved slightly. The community is working on getting better internet services and pursuing businesses that can breathe new life into this county, bringing jobs and medical care. From Wheeler County, Daniel McFarland, WGXA News.
Now, just to talk about that internet service a bit, I actually had better internet service in Kathmandu after 2 7.3, 7.8 earthquakes than many of my neighbors in Wheeler County today. So that's, when I talk about wicked problems, that's a complicated one. Rural health is not something that I focus on in my research, but it's something that I'm starting to really pick up, especially moving to Georgia Southern. Wicked problems related to fragile and vulnerable settings and weak primary health care are something that can be seen in Wheeler County. There's people here that study rural health, such as Charles Owens, he's a guru, and it's really important from a research perspective and from a transdisciplinary approach that you take into these ideas, or take into mind these ideas about OneHealth, because the rural health is centered around things like human health, animal health, and environmental health. Now, this came out in 2014. If you want to watch a rural community die, kill its hospital. From the same mayor, it's been devastating. This is a beautiful place to live, but you better have brought money because you can't make any here. It's a complex problem and something that is not easily solved. You can see the closure from the Lower Oconee Hospital, where I actually had my very first job as a teenager away from the PPASH, actually left a huge gap in the state. And so as a part of service learning projects that I've been working on here at Georgia Southern, we've been trying to come up with innovative ways to reach this population. And one of these has been the drive-through flu clinic. I don't know if you recognize this guy, but that's my dad. I even got him through the drive-through. But the point is innovative, creative methods are really needed in order to take into account all of these complex linkages. Here, it's the video said loggers, truck drivers are very important to our economy. Here, you can notice that we can meet people where they're at in order to bring help to them. Now, I'm going to tell you background here is that basically this guy was just trying to make a delivery to a school that we were using the drive-through clinic for, but how great would it have been if we were able to reach those people? From a OneHealth perspective, there's actually drive-through clinics that will help vaccinate the animals. And so why just focus on the humans when you can also incorporate the animal component? In fact, there's a clinic out in California that you can go in with your animal and you both get vaccinated. And that's super important from a preventative health standpoint. Another service learning project that we're focusing on is looking at evacuation and communication plans for the movement of people from coastal Georgia inland to the South Central Health District. We were able to work with the South Central Health District as well as Epidemiology County EMA in order to talk about this. One gap that they highlighted, the students found, and then the EMA said, yeah, that's a gap, was what do you do when shelters reject animals? So after Hurricane Katrina, we found that a lot of people stayed behind or prematurely went back because of their animals. So ignoring the human-animal bond is actually it's not always readily apparent, but when you dig down deep and you really get into the community, you can see that that certainly can be a problem. So I hope through this talk I have shown you the value of the OneHealth approach. I don't mean for you to change any of your ways or redirect any of your research, but simply just say, how can I incorporate animal health and environmental health perspectives in order to do something that benefits all? Those benefits can be seen through saved human and animal lives, reduced human and animal suffering, financial savings, because you're not having your own animal health surveillance system and human health surveillance system. Instead, you're actually working together, and then essentially improved ecosystem services. Now, if you want to get involved with the OneHealth project, or the OneHealth approach, I kind of split it up on different levels. Locally, you can take the OneHealth course that's offered here. I believe this is the first time in the last couple of years that a OneHealth course was ever taught here at Georgia Southern. So certainly you're able to sign up. It's a fully online course. Also, there is a OneHealth organization here on campus if you are interested. Regionally, I want to encourage you to reach out to your local health departments, because all of these OneHealth applications did not necessarily just kind of spring up and say, oh, well, there's an opportunity for action. Rather, I reached out to my local health district and said, how can I help you? How can we as students and we as faculty help you? And they gave us these kind of conundrums, these problems, these areas for us to help out. And then we said, wow, look at the OneHealth, application here. Also at the national level, with the APHA, if you're a member of APHA or you want to become a member of APHA, I would encourage you to join the Veterinary Public Health group. It is very OneHealth focused group, and we have a ton of fun. It is a great transdisciplinary group that includes veterinarians, public health professionals, and even consultants and members of the community. Zoom calls, zoonoses, and OneHealth updates is a free call with the CDC that you can join in. And I'm hoping to start a Nepal study abroad program. But the only way I can do that is if there's interest. There's definitely interest from Nepal's perspective. There are a lot of students who are interested. So if you're interested on this end, please let me know. And then finally, just looking, how can you apply the OneHealth approach to your life? Maybe individually, you say, okay, well, I do things like I recycle, I don't engage in a lot of consumption at Christmas time, or try not to at least. But ultimately, trying to figure out these different avenues for applying to OneHealth is going to be unique to your own situation, and I'm super happy to brainstorm. Finally, I don't want to leave any negativity associated with these areas that I talked about. When you think of these two places, I don't want you to think of wicked problems, but instead think of all the good. Nepal is one of the most beautiful countries I've ever seen. Beyond that, and even more important than that, the Nepali people are so kind and so resilient, and it's just such a beautiful, beautiful country. Finally, coming back to Wheeler County, while I agree with Mayor Joyner, it is a great place to live, I respectfully disagree with him that we have to expect a lack of services in that area. And so obviously, you probably all know about the importance of participating in local politics and participating in the local community. But I actively choose to raise my kids there. So that maybe they can also spend some time in the PPAC and really do some character building exercises as well. So for my acknowledgements, I just want to acknowledge groups of people. One in particular, my best friend from high school, we both became epidemiologists. He is actually an epidemiologist for Merck Pharmaceuticals up in Philadelphia, but he is definitely a teammate in all the research that I do, and a sounding board of all of my ideas. Also, in the South Central Health District, Jody Bazemore, she is also a Wheeler County graduate, and she is an epidemiologist. And she is the director of epidemiology and emergency preparedness for the South Central Health District. For some reason, epidemiologists are coming out of Wheeler County. I would also like to thank all of my colleagues in Nepal at Maine Medical Research Institute, at UC Davis, and particularly here at Georgia Southern. I have 2 graduate students who are fully on board with all of the OneHealth research, and that is just so helpful and inspiring. And also Dr. Cowan and Ryan Buck, who are really all in with the drive-through clinic approach and are helping out with that research. So hopefully, I know we're a little over time, but I am happy to answer questions now or later. You can reach me.
So we have time for about 2 questions for Dr. Schwind. So please, if you have any.
This is either good or bad.
Okay, so and for those, you get a question. So.
I just have a question about, when you talk about Nepal, and you talked about their resilience in reference to their exposure to protests. What do you mean by their exposure to?
Yeah, so that means exposure to dead or dying things. That was the way that the validated survey was used to kind of classify things, but really we wanted to separate, okay, well, we just lost our home versus we saw family members or close friends pass away and we witnessed that. It could have been they were trapped under rubble, or it could be that they passed away, at secondary to the earthquake further down the line.
Okay. All right. Well, thank you. Please fill out the assessment and let us know what you think. And for those that are online, hopefully we'll follow up with you so that we can know this. Again, let's all thank we appreciate your feedback. So if we all have ideas for others, we'll have both Ken speak as part of our grand rounds. We hope to repeat this in the spring, depending on the feedback, and also our seminars. Please let us know, and we'll go from there. So thank you. You all have a good weekend.
Okay.